What are the 10 warning signs of dementia? These early signs of dementia are memory loss, difficulty planning or solving problems, difficulty doing familiar tasks, being confused about time or place, challenges understanding visual information, problems speaking or writing, misplacing things, poor judgment or decision making. What are the early signs of dementia? The most common early symptoms of dementia are memory loss, difficulty performing familiar tasks, problems with language, disorientation to time and place, poor or decreased judgment, problems with keeping track of things, misplacing things, changes in mood or behavior. How does dementia start? Dementia is more common in people over the age of 65, but it can also affect younger people. Early onset of the disease can begin when people are in their 30s, 40s, or 50s. With treatment and early diagnosis, you can slow the progression of the disease and maintain mental function. Is forgetting words a sign of dementia? Memory loss and dementia. Often, memory loss that disrupts your life is one of the first or more recognizable signs of dementia. Other early signs might include asking the same questions repeatedly, forgetting common words when speaking. How does peanut butter detect Alzheimer's? The peanut butter test is a diagnostic test which aims to detect Alzheimer's disease by measuring subjects' ability to smell peanut butter through each nostril. The researchers believe that people with Alzheimer's were not able to smell the peanut butter as well through their left nostril as their right one. What conditions can be mistaken for dementia? We highlight the most common conditions that may cause signs of cognitive impairment that are mistaken for dementia: urinary tract infections (UTIs), ever observed sudden bouts of confusion, also known as delirium, in older members of the family. Depression, normal pressure hydrocephalus (NPH), subdural hematoma. How can you test for dementia at home? The SAGE exam. SAGE was formulated to detect the earliest signs of cognitive impairment and was developed by researchers at The Ohio State University Wexner Medical Center. The test can be done at home in 15 minutes with paper and pen. What should you not say to someone with dementia? Do you remember? And other things not to say to someone with dementia: stay in the present moment. Avoid asking the person questions about the past, rather, tell your own stories that don't involve the person's input. Avoid distractions. One step only, if asking a person with dementia to do something active. How do you test for dementia? The following procedures also may be used to diagnose dementia: cognitive and neuropsychological tests. These tests are used to assess memory, problem-solving, language skills, math skills, and other abilities related to mental functioning. Laboratory tests, brain scans, psychiatric evaluation, genetic tests. Can dementia get worse suddenly? Dementia occurs due to physical changes in the brain and is a progressive disease, meaning it gets worse over time. For some people, dementia progresses rapidly, while it takes years to reach an advanced stage for others. The progression of dementia depends greatly on the underlying cause of the dementia. Is anger a sign of dementia? Agitation and mood swings. In addition to agitation, rapid and seemingly unprovoked mood swings are another sign of dementia, going from calm to tearful to angry for no apparent reason. Do people with dementia sleep a lot? It is quite common for a person with dementia, especially in the later stages, to spend a lot of their time sleeping, both during the day and night. This can make the person sleep more during the day as their symptoms become more severe. What are the 6 stages of dementia? Reseburg's system, Stage 1, no impairment. During this stage, Alzheimer's is not detectable and no memory problems or other symptoms of dementia are evident. Stage 2, very mild decline. Stage 3, mild decline. Stage 4, moderate decline. Stage 5, moderately severe decline. Stage 6, severe decline. Stages 7, very severe decline. How quickly does dementia progress? It's usually a slowly progressing disease. The average person lives 4 to 8 years after receiving the diagnosis. Some people may live as many as 20 years after their diagnosis. At what age does memory start to decline? Memory loss can begin from age 45, scientists say. As all those of middle age who have ever fumbled for a name to fit a face will believe, the brain begins to lose sharpness of memory and powers of reasoning and understanding not from 60 as previously thought, but from as early as 45, scientists say. Can you smell peanut butter if you have Alzheimer's? The peanut butter test is a diagnostic test which aims to detect Alzheimer's disease by measuring subjects' ability to smell peanut butter through each nostril. The researchers believe that people with Alzheimer's were not able to smell the peanut butter as well through their left nostril as their right one. What is the number one food that fights dementia? Cruciferous vegetables. Broccoli, Brussels sprouts, cabbage, and other cruciferous vegetables contain sulforaphane, which powerfully assists in DNA repair. They're also high in folate and carotenoids, which lower homocysteine. High levels of this amino acid are linked to cognitive decline and dementia. Can dementia be seen on an MRI? A brain scan, using either computed tomography (CT) or magnetic resonance imaging (MRI), is generally included in the standard evaluation for Alzheimer's disease and other forms of dementia. Ellipsis. These scans can also show the loss of brain mass associated with Alzheimer's disease and other dementias. Do people with dementia know they have it? Alzheimer's disease progressively destroys brain cells over time, so during the early stages of dementia, many do recognize something is wrong, but not everyone is aware. They may know they are supposed to recognize you, but they can't. Can dementia be brought on by stress? Too much stress in your life can ultimately lead to depression and dementia, scientists have warned. A major review of published research suggests that chronic stress and anxiety can damage areas of the brain involved in emotional responses, thinking and memory, leading to depression and even Alzheimer's disease. What does the beginning of dementia feel like? A person with dementia feels confused more and more often. When they can't make sense of the world or get something wrong, they may feel frustrated and angry with themselves. They may become angry or upset with other people very easily. They can feel happy, safe and calm. What is the 30-question cognitive test? The Mini Mental State Examination (MMSE) or Fulstein test is a 30-point questionnaire that is used extensively in clinical and research settings to measure cognitive impairment. It is commonly used in medicine and allied health to screen for dementia. What questions are asked in a dementia test? Memory problems. When we talk about memory problems and dementia, we basically mean short-term memory, that is, memory for recent events. What year is it? What month is it? Without looking at a clock, what time is it to the nearest hour? Count back from 20 to 1. Do dementia patients tell lies? It's true that in the early stages of the disease, people with dementia might fib to cover for memory loss. But most examples of lying are dementia symptoms rather than intentional deception. Specifically, it's called confabulation, unconsciously replacing lost memories with fabrications. Should I tell my mom she has dementia? Consider telling your mother more about her diagnosis. Some families will be very direct and even use the word Alzheimer's. Put a positive and loving spin on it. For example, you can say that the doctor has diagnosed her with memory loss, but then say something like, "But mom, we are in this together." How do you talk to someone who has dementia? 10 tips for communicating with a person with dementia. Set a positive mood for interaction. Get the person's attention. State your message clearly. Ask simple, answerable questions. Listen with your ears, eyes, and heart. Break down activities into a series of steps. When the going gets tough, distract and redirect. What dementia feels like. A person with dementia feels confused more and more often. When they can't make sense of the world or get something wrong, they may feel frustrated and angry with themselves. They may become angry or upset with other people very easily. People with dementia can still feel nice feelings, too. How do I know if I have the start of dementia? Common early symptoms of dementia: memory loss, difficulty concentrating, finding it hard to carry out familiar daily tasks, such as getting confused over the correct change when shopping, being confused about time and place. How can you tell if someone has dementia or Alzheimer's? 10 early signs and symptoms of Alzheimer's: memory loss that disrupts daily life, challenges in planning or solving problems, difficulty completing familiar tasks, confusion with time or place, trouble understanding visual images and spatial relationships, new problems with words in speaking or writing.